We have now moved into the anesthesia induction area. This is where we will bring our pre-medicated pets and induce them for anesthesia and place them on the anesthetic machine with the inhalant anesthetic and prep them for their surgical procedures. And in the background you can see that we are setting up our tables, getting some of the supplies together that we will need, monitoring equipment, catheters, endotracheal tubes, and we will walk through that process when the pets arrive. This is propofol. And this is our induction agent that we will use to induce anesthesia in our patients. You can see that it is white, and that is because it has egg as part of its components that it's made up of. Normally, you would never want to give anything that was white intravenously into an animal. In this case, it's the one time that it's okay. The reason that you don't give other drugs that are white in color intravenously is because one of the most common ones that we use is amoxicillin, which is an antibiotic, but if you give it intravenously, the animal will have a seizure and could die. One of the other most important things, of the many important things that we do preoperatively, is to check our anesthesia machine. We want to make sure that it has enough oxygen, enough inhalant anesthesia to last us throughout the procedure. We want to make sure that all of the hoses are connected properly so that the animal is able to receive fresh air, exhale used air, and not have a leak in our machine or have a pressure problem that causes it to back up into the animal's lungs. All right, so we're going to pressure check this machine. So we turn on the oxygen and the oxygen flow. We plug all of the possible openings from the machine. So we plug the end of the tubing that will connect with our animal, and we close our pop-off valve. And then we make sure that the reservoir bag is filling up with oxygen, with air. And when we place pressure on it, we want to see on the manometer that it can hold at least 30 centimeters of water of pressure without leaking any of that air. So this machine is checked properly. It does not have a leak. If the machine did have a leak, that would mean that our animal was not receiving a constant, consistent flow of oxygen and inhalant anesthetic and could lead to problems intraoperatively with keeping them at a surgical plane of anesthesia. Anesthesia table is set up to induce the pet. We have everything that's ready to go. We have our anesthesia machine that we have pressure checked and checked for anything wrong. We know that it works correctly. We have our endotracheal tube. This is going to be inserted into the dog's mouth and down into the trachea. This allows us to control the dog's ventilation and ensures that we always have a patent airway with no obstructions or problems with the animal being able to breathe. We have a tie placed on this already. When we place it, this will then be tied around the dog's nose to hold it in place. Once the tube is placed, we will put pressure into the cuff on the end of the tube. And now, when this is down into the animal's trachea, it makes an airtight seal so that we always know that as the animal breathes, it is only breathing the gas that we want it to breathe. It's not going to receive any outside air in the process. We have our induction agent. We have our items that we need to place our intravenous catheter. That gives us vascular access for inducing the animal, as well as access for fluids to help maintain blood pressure and for emergency drugs if we were to run into a problem. We have our prep materials, a combination of chlorhexidine and alcohol, and this will reduce the bacterial count on the animal's skin and help reduce the risk of infection. We have our intravenous fluids, and these will help to maintain the animal's pressure. And then we have our monitoring device that we will connect to the animal that will measure its heart rate, pulse oxygenation, and blood pressure. Here at the Veterinary Teaching Hospital, students are involved in every aspect of patient care. And you will see throughout these procedures that there will be students that are running anesthesia, maintaining the pet on anesthesia, and I will also have a student that is scrubbed in with me that will be assisting in this procedure. When I am not performing these procedures for you, my students are the ones who are actually performing the procedure with minimal assistance on my part. I make sure that they are doing things correctly and properly properly, but this is an opportunity for all of them to get vital hands-on experience in how to perform common procedures when they graduate and are in private practice. So here is Isabelle, and she has had her pre-medications now. It has been 15 minutes since we gave those, and you can see that she is a much different dog than she was 15 minutes ago. She is more sedate, she's not as anxious, she's not doing as much panting and whining as she was before. And we are now going to get her prepared to place an intravenous catheter. So we place her on the table, and the next thing that we're going to do is clip a spot on her forearm in order to place the catheter and get vascular access without having to go through a lot of her fur, a lot of her hair. Some dogs are very relaxed about the clippers. Some dogs get very anxious about the clippers and the way they sound and the way that they feel on their skin. We'll see how Isabelle does for us. So, as we're getting her clipped here, you can see that our technician is controlling her head so that she doesn't bite anyone out of fear, and that also just helps her to realize in her pre-medicated state that she's not going to be able to go anywhere, and that this needs to get done. And that's all that we need. That's all the space that we need to clip for a short-term catheter. It's just to get a little bit of that hair out of the way. And now we are going to do a prep on the skin with chlorhexidine and alcohol. Again, that is to reduce the number of bacteria on the skin so that we will not get an infection in our catheter site. The pink solution is the chlorhexidine, which is an antibacterial and antifungal solution. The white sponge has alcohol on it, which is also very effective at killing bacteria. And the alcohol also helps remove some of the grease and from the dog's skin that could be harboring bacteria as well. And you can see that now, once again, now that the clipping is all done, that Isabelle is doing fine. She's a dog that doesn't seem to like change very much. They're all different. Okay. So we're going to place the intravenous catheter, and this is going to go into her accessory cephalic vein, which is the vein that runs right along the top of her forearm, the dorsal surface of her forearm.
I just wanted to warn you before I did it. That way
So the catheter has been flushed with heparin so that it doesn't get a clot in it as soon as it's placed, and you're going to see that it's going to be placed into Isabelle's skin. And once it's through the skin, it's going to be directed into her vein. And we know that we are in the vein when we get a flash. We're going to see a flash of red blood in the end of the catheter. You can see that there. We know that we're in the vein. And now that catheter should slide smoothly into her vein. And you can see that Isabelle didn't even care about that part. And we place a port on the end of the catheter. So now the blood can no longer flow through it. And we're going to tape that in place. A secure tape job is critical. We need to dry off the blood, make sure the skin is dry to place the tape. You do not want to place your intravenous catheter, move the animal into surgery, and then realize that your catheter just pulled out. So everyone has their own little unique ways that they like to tape catheters. What we're doing here is we've placed tape actually that is directly on the catheter and then have taped that around the dog's arm. And now we're going to use another piece of tape to reinforce that placement. Yes, this is going to allow us, we need to give our propofol, our induction agent, intravenously. You don't want that to get out of the vein because that will irritate the tissues. So by having an IV catheter placed, that guarantees that all of it will go into the dog's veins. And this is also going to be where we will connect our fluids, and our intravenous fluids will help maintain the dog's blood pressure under anesthesia. Anytime that you are anesthetized or an animal is anesthetized, one of the big things that you deal with is hypotension, low blood pressure. And by giving a high rate of fluids, we are able to maintain that pressure at a more normal level. And that is important for organ perfusion, making sure that your brain, heart, and kidneys all get the oxygen that they require. So now we're going to give the propofol, and this is an induction agent, and this is going to basically disconnect her brain from her conscious brain from the rest of her body. So you'll see that we're going to give it to her, and she is in just a few moments her head is going to slump down like she's just suddenly fallen asleep. And we give this to effect. We've calculated up a dose for her, but we're not necessarily going to use all of that dose. We're going to give as much as we need to get the job done and not give her more than that. And she's starting to feel it a little bit now. You can see her, she's starting to slump down. Her eyes are kind of blinking like she's trying to fall asleep, and there her body has slumped over. They are now going to check her jaw tone, and her jaw should be very flaccid and loose to place our endotracheal tube. Our technician Brent is now holding open her mouth, and she wants a little bit more drug. You saw how she just twitched her head there. She's not all the way asleep, so it looks like Isabelle is going to need all of her propofol that we calculated. And there we go. Now she's relaxed. So we open up Isabelle's mouth, and Dana is looking between the arytenoid cartilages of her trachea and placing the endotracheal tube. And she has seen it go into place, and that's the best way to tell that your tube went where it belongs. And now she is going to tie the tie around the dog's nose. As soon as she gets it just the way she wants it, there we go, she likes it. It's getting tied on its nose. And you want to tie this securely. You're not going to cut off blood supply to their nose or anything like that. You don't want this tube to slip once it's in place. And now we are attaching the anesthetic machine to the endotracheal tube. And we now have oxygen and isoflurane flowing to the patient. And the next thing that we are going to do is, you might want to turn on your isoflurane. The next thing that we are going to do is check her lung sounds. We want to hear even lung sounds on both sides. One of the problems that you can run into with an endotracheal tube is that if you place it too deeply into their trachea, it will slip down into one bronchus or the other. And when you give the dog a breath, you're only inflating one lung and not both of them. So they listen with their stethoscope to her lung sounds. They want to make sure that they sound even. And now Dana has her head near the dog's mouth, and she is listening for a leak as she inflates the cuff of the endotracheal tube to make sure we have an airtight seal. If it is not tight enough, she's going to hear a hissing sound as the air leaks around it when the pet is given a breath. And if it is tight enough, she will hear nothing. We just placed lube into the dog's eyes. They no longer can blink correctly under anesthesia, so that lube will keep their eye from drying out during the procedure. We're connecting our intravenous fluids to our catheter. They're getting the drip rate set at the correct rate for the dog to get just the right amount of fluids, not too much, not too little. And here in a moment we're going to roll her over so that we're going to get some monitoring equipment attached to her and roll her over so that we can get her prepped